as misinformation about the coronavirus spreads as quickly as the virus itself, two of the world's most esteemed virologists contacted the BBC to educate the public with research-based causes and treatments. Joining us now are Doctors Derrick Thickcott of the University of Oxford, well known for his research in ratification of booty cooties, as well as Dr. Trevor Greenhog from the University of Cambridge, who's well known for his research in regards to penis enlargement in frogs.
Pleasure to be with you.
Yes, thank you. Thank you.
Gentlemen, I'm sure if you're anything like me, you've spent the past 2 weeks washing your hands as though you've been finger badgering cockeyed birds down by the canal all evening.
Mm-hmm. Yes.
Here we are.
That's correct. 2 hands deep in the stream, pebbles between them, awash in goose cum. It's an ugly sight.
And Dr. Thickcott, how are you today?
I'm well. I've mostly been keeping my immunity boosted with irregular ejaculate patterns. I have found in early research that if you're able to keep yourself and your penis from succumbing to ejaculate, you will build immunity. Now, I have no proof. It's anecdotal at this point, and for the most part, it's been horrible. But, you know, that's research for you.
We're all managing, doctors.
Yes.
First off, doctors, I'd like to ask your opinion on where are authorities going wrong? Dr. Thickcott?
Authorities, I think, you know, for the most part, I think it's an issue with not basically, we need to talk about the fat nurse problem, in my opinion. And I think that, you know, we definitely have a fat nurse problem, and that needs to be mitigated. I mean, there's too many fat nurses, which is leading to too much complaining. And the complaining is making the healthcare system worse. Basically, the fat nurses complaining are putting a strain on the patients and the healthcare system.
Fascinating. So to be clear, doctor, it isn't the human-to-human contact, but rather the gargantuan bescrubbed chair squeakers in the medical system that are causing this virus to spread.
Yes, it's fat nurses are the problem, and it's the reason this is getting out of control, and we need to slow the spread.
If I may interject, if I understand my colleague correctly, he's telling me that we have an overabundance of fat nurses, and the drain they place on the NHS and other governmental systems is simply drowning out any sort of effective response to the coronavirus. And I think that there's just nothing to back up what he's saying whatsoever. This is completely anecdotal. If anything, I believe the numbers suggest that we need an increase in fat nurses.
That is absolutely, I'm sorry to interrupt, but that is absolutely mental.
Doctor, I understand it's been a long time since you've been permitted to practice, but I can tell you, being on the ground, although serving a 4-year delicensing suspension, I can tell you myself, the amount of complaining fat nurses are doing frees up some of the thinner, more attractive nurses to handle patients in a more timely manner. And I think any doctor worth his salt will back that up.
Absolutely not. Absolutely not. I think the problem with the fat nurses is if we keep them around and they keep practicing their medicine, what will happen is they will spread the complaining to the, you know, thinner, more attractive nurses. And now you have thin, attractive nurses complaining. And once that happens, it gets out of control and almost every patient wants to kill themselves.
There's absolutely no clinical evidence supporting the idea of nurse-to-nurse complaint transmission. The numbers are not there. The science does not back up the claim. If anything, we need more fat nurses.
More fat nurses, that is, I mean, is someone going to step in here? That's absolutely insane. More fat nurses. The data may be anecdotal, but it's there. That's what data.
Doctor, I'm sorry.
If I may interject for a moment, what we can all probably agree upon is that nurses are in fact getting fatter during this pandemic. I have the research right here. It says that many fat nurses are lining the insides of their surgical masks with the sort of jellies and jams and puddings.
Yes.
Small step in the right direction, as far as if you ask me.
That is, I mean, absolutely. First of all, to your point about data, it's Dr. Eli Ballington in France. He found that the more fat nurses in his hospitals resulted in more suicides amongst patients. Now, you have people dying from coronavirus, dying from, cancer, and now you have people blowing their fucking brains out because they can't stand the complaining. Now, I mean, I have a suggestion for mitigation, and that is to put the fat nurses on the highest floor of the hospital and not allow them access to elevators. That way they have to take the stairs, and hopefully in 4 months, we see a decrease in the amount of fat nurses in the hospitals and an increase in proper patient care and a decrease in complaining as well. That's my solution. Put them on the top floor. Or you can't get rid of them completely because it will be considered amoral, and I'm sure my friend here will complain about that as well.
Well, Dr. Thickcott, to your point, perhaps doctors and hospitals can take the lead here and perhaps place the charts further across the room to extend the number of steps that nurses may have to take to access it, keeping them away from patients.
Yes, exactly right. We need to control the situation. We need to flatten the curves.
Or flatten the curve, to Dr. Greenhog's point.
Correct. This hogwash, I would call it, putting fat nurses on higher floors. Number one, the patients on the higher floors will suffer as these nurses are known to take breaks. If you put them in any sort of enclosed stairwell, it becomes a 15-minute cell phone break, looking at just the most inane content imaginable, not to mention vape pens, not setting off smoke detectors. They've got nothing but opportunities to drag their feet and to complain to their other fat nurse friends. You're exacerbating the issue and not treating it. And all this, what we're doing now is we're circling around the issue without ever looking directly at it. And the issue remains. The more we discourage fat nurses from practicing, from bothering patients, from showing up at families' bedsides and bothering them at different hospitals, the worse we handle epidemics, especially with how much of a resource of knowledge these fat nurses are to their own families.
I mean, that is absolutely, I mean, I've said it once before, and I think it bears repeating. It's absolutely mental to think that we need fat nurses in the hospital. What they are doing is causing such a strain. I mean, think about there's a hospital in now Singapore. You see a very low incidence of deaths, and why is that? Good luck finding a fat woman in Singapore. Unless you're combing the bottom of a lake.
With all due respect, Doctor, it seems to me that you are turning a correlation into a causation, and it's simply not the case. Well, we've seen hospitals try putting fat nurse parking spots further from the entrance with no effect whatsoever. If it only increases parking fines for some of these pigs.
It is early in the testing now. It's early in the testing, so you cannot say that the evidence is totally not based in reality when we haven't even seen the effects. I mean, the cases are surging, the people are coming in, and all you can hear from outside is ringtones and ahs and yeahs and ahs, and they're all coming from fat nurses. Inside the hospital, you've got screams coming from patients, and outside the hospital, you've got moans coming from fat nurses. And to say that this is not creating a significant problem is absolutely the ramblings of I hate to say it, someone with much less education than yourself.
Doctors, we know that misinformation about the virus itself is causing significant issues throughout the world, but is there specific information that fat nurses are perpetuating on Facebook that may help flatten this curve, or maybe exacerbating the problem?
If you ask me, one of the greatest assets we have combating a global epidemic is the information shared via fat nurses posting mignon memes. without without Facebook and Instagram posts starting with everyone knows that one nurse who, unfortunately, I think we wouldn't see much information disseminated at all. And if I may, allow me to paint you a picture, Dr. Thickcott. You are a practicing physician working in a hospital, making your rounds. You come upon a nurse's station, and standing at this nurse's station are two very attractive, very fit nurses.
Yes.
On a good day, be honest.
Yes.
How much time does that add to your rounds?
I would say now I understand what you're saying, and you're basically painting me into a corner to say that the erectile response I'm having from a I'm sorry, I was thinking about a meme I saw earlier of a tiny child riding his Vespa into the front window of the cafe, and everyone going, ah.
Oh, yes. Sensible humor.
Now, what you're saying is I will be distracted sexually from the other nurses. Now, that is assuming that I don't like fat nurses sexually. I would say it's the opposite. I'd say I essentially oscillate between the two of them depending on my mood. Now, granted, if I do come upon an attractive nurse and that changes my posture, that I would imagine that increases my productivity and also helps me do my rounds. Now, granted, I am not allowed to practice due to a prostitutionary indiscretion of last year, but I will say that that's irrelevant. That's irrelevant. I would like that scratched. I would like my answer scratched and start over. If you're watching this, ignore what I said. I do not get erections from nurses. I am a total professional. I wait till I get home. Moving on.
Dr. Greenhog, if I will, in regards to your comment about fat nurses being utterly obsessed with minion memes, is there a correlation between fat nurses loving minion memes and the initial thought that a fat nurse may have after eating an entire pizza at the nurse's station being, ugh, despicable me?
I mean, that
first let me say that on the issue of fat nurses being more sexually attractive, that is one area where my colleague and I agree, and I flatly state that for the record. To your second point, I think
race also, it bears in mind to mention that race does help where the attractivity level goes with a fat nurse. I mean, if we're talking, if there is a nurse of Puerto Rican descent, I will be honest, I am a bit of a moth to a flame in that situation.
Once again, Doctor, we are in agreement. There's nothing I pursue more in a professional setting than the, I would say, respect of a, how I would say, a spicy Latina nurse.
Yeah, I would agree.
Dr. Thickcott, if I will, I too enjoy a good, thick Puerto Rican woman, so much to the point where I disagree with you referring to it as Puerto Rican descent and more of a Puerto Rican accent.
Ah, yes. That's a good point, and well taken. I think we're all in agreement there. I would say, yes.
Doctor, as far as I'm concerned, they deserve 2 parades.
Yeah, yes, I agree with that. I mean, I'd have to be seated. I'd have to be sitting down.
Gentlemen of thought, perhaps if we put these coronavirus patients on parade, would that decrease the likelihood of these fat nurses continuing to exacerbate their symptoms?
That's interesting. I think a large majority of the coronavirus patients would die on parade. I think that's, it's more of up to a vote situation.
But perhaps if they had the right mentality, like they get out there on the parade route, they start saying, oh, I've got body aches, oh, I've got a runny nose, and you say, follow the float, mate.
Interesting. It could be effective. I mean, again, to me, That sounds much more effective than more fat nurses, if I'm being honest.
Unquestionably, gentlemen.
So you're doing your viewers a disservice by completely ignoring the fact that if you were to attempt a parade of all current living coronavirus patients and expecting every fat nurse working today to attend, we simply could not support that kind of event with our current supply of foldable beach chairs.
There's no denying that, Dr. Greenhog. And gentlemen, well, I have both of you here.
Yes.
What can the public continue to do to mitigate the health ramifications of self-quarantine?
I'll let my colleague answer first.
Number one, re-follow all of your fat nurse relatives on Facebook. They're going to be your greatest wealth of information as we move forward. We're only getting deeper into the epidemic. I don't see any end in sight. The governmental response around the world has been lackluster, and I will finish by saying that we just simply are not hiring enough fat nurses.
I would say during this quarantine, everyone with a BMI below 40 should start do some internet research on how to care for patients, because come July, there is nothing more combustible than a hot, fat nurse. Nothing more combustible. And once we are dealing with that in July, that is going to be something that I guarantee will, you're talking about flatten the curve, it's going to be the exact opposite.
Well, one thing's for certain, Doctor, I guarantee you I will come July.
Gentlemen, if you will, should there be weight standards in place for when nurses gain weight? So, for example, say a nurse gets above 200 pounds, you say, all right, you're wearing pink from here on out.
Yeah, I mean, you know, one of the reasons I was asked to leave my old hospital was because I recommended that nurses be given color coordinated hats, and the heavier they got, the smaller the hat gets. So it's more comical, therefore more embarrassing, and that was considered rude, not professional. But you know, it did help the problem because a lot of them quit. So then I got rid of a lot of them. So again, I think that is a good idea. I also think you know, to make a point, we should also get rid of the overly fit nurses. Talking men, you know, with visible abdomen in the workplace. I don't think they're much for help either. If anything, when they sit in the break room and eat the rice and boiled chicken out of a fucking Tupperware container, I think that's nothing lowers morale lower. Nothing dips morale deeper than one of those cunts.
I personally will not hire a male nurse, non-fat, with a wrist thicker than about that. That's about the wrist thickness I'm willing to tolerate for a male nurse. I find anything thicker than that, they will take up all the nurse pussy for themselves. Yes, I
agree. Also, you want to be able to grab a nurse, a male nurse, and give him a good knock it off. You know, I always hired male nurses that I could really beat the shit out of, because I would deal with you know, the women nurses. The problem is you can't as much as you want to. You can't. And so I would hire a male nurse that, you know, if I was having an issue with a female nurse, I'd say, give me a minute, call up Derrick, he'd come in, I'd give him a licking, and, excuse me, come down with something. Don't know what it is, but.
Doctors, is there, in your expert opinion, is there any way that we could perhaps keep fat nurses away from patients by telling them that the patients are in a vegetative state, by associating the word vegetative to them, they might associate that with vegetables and be more inclined to stay away from the room. Whereas if we're telling them that that the patient's in a cheesy state, they might do a backflip into the room.
I think that would be yes. I would say you know, don't go in there. There's a Peloton in there.
Forgive me. Sorry. This is a short-sighted measure. This has already been debunked. This is a measure that's already been defeated through methods. Hospitals are tricking fat nurses into car accident patients' rooms by telling them they've been candy crushed.
Well, Dr. Greenhog, I have evidence here pointing that fat nurses have been using motorized beds to traverse the hospital floors.
Yes, the Wally Initiative has been promising in southern England. Several hospitals tested it out, and the added mobility has only made the fat nurses more effective.
And Dr. Greenhog, not only are they mobilizing using these motorized beds, but they're also going so far as to placing bumper stickers on the beds. Case in point, I volunteered at a hospital in Scunthorpe. Saw a fat nurse gliding down the hallway in a motorized bed with a bumper sticker that said, "Honk if you chunk."
There is nothing that a fat nurse sits on that will not end up having a bumper sticker on it. That is a promise. If there is a fat nurse to be found, she is, chances are, 6 inches below her arsehole is a bumper sticker.
To that point, Doctor,
Yes.
Should we get to the point where a bumper sticker ban has to be put in place?
I've said that since the beginning. I've been saying that for years. No bumper stickers. The second I see a bumper sticker on a nurse's car, I know she's going to be trouble. She's going to cause a bunch of ruckus. There's going to be complaints about the vending machine. I can't tip it, or it tipped over too far. I broke the fucking window. I've been here before, and they all come from people with stickers on the car that say something specific about cats. The mystery of, candy or some fucking nonsense like that. I can't even think of one. But the only bumper sticker I would like is I upside down heart fat nurses.
However, Doctor, if we run the risk of banning bumper stickers, what do we do when ordinary citizens start renaming Muslims as bumper stickers?
Yes, that's it. Interesting.
Get rid of them. Get rid of them.
I mean, that's your stance? That's absolutely mad.
Hold on. We'll edit that out for a second. I got a fucking pop-up from Zoom. God damn it!
What time is it, by the way?
Oh,
shit. I got to go pretty soon, but...
all right,
where does it end? Where does it end? You remove bumper stickers. You don't allow them.
Certainly not at the end of a Doritos bag.
Exactly.
If you're to bar fat nurses from using bumper stickers, what next? You bar them from using memes. Then information stops. The infection spreads. Society collapses.
Why are you...
Fat nurses rely on bumper stickers, or as I like to call them, car memes, to unload their aggression. Otherwise, you get clumps of women, initiated by fat women, but not always, complaining about ex-husbands, ex-boyfriends, overtime at their husband's cop job. Production slows down, patients die on the table.
Well, Dr. Greenhog, to that point, perhaps we could have a few Barbies go in there, and the second he sees them at a nurse's station about to pop a cruller into the mouth, be like, "Hey, none for you."
I think that could help. I think the number one problem is the complaining, and if we cannot do something to mitigate that, you will have these memes that are nothing but disinformation. To say that they are informational is, again, I hate to reuse the word, but mental. It's silly, basically, as long as they're complaining and as long as they have boyfriends that drop them off too far away from the front door, we're going to have problems.
Well, gentlemen, is there anything else you'd like to add before we go?
It's been a pleasure, gentlemen. If anything, I would just like to petition the judge in my case to consider dropping the charges. I do have video of her agreeing.
Yes, and if I can use this platform as well, I would say that that child hit my car. Again, we're still in the middle of the process, but and I've still got a cracked windshield. But I would say, you know, the evidence will show that I was I was taking a left on the correct street. Forget it. It was nice to be here. Thank you guys so much. And again, I mean, just try to flatten the curves.
Well, I wouldn't mind if we flattened the curve, I'll tell you that much. Dr. Thickcott, Dr. Greenhog, thank you. Stay tuned to hear the official statement from Buckingham Palace as to why BBC guards stabbed a squirrel to death before he could reach the Queen.